I'll be talking about study 3, which was the Sanderson et al. 1964 article, an investigation of a new adverse conditioning treatment for alcoholism. So a little bit of background information about this study. It was a common study type from the 1950s through to the 1970s. And so in particular, this study looked at the classical treatment consisting of a conditioned stimulus, which was the alcohol. So participants were connected to a chemical shock stimulus every time in an isolated room, and every time the participants reached out for a bottle of alcohol, they would be shocked. So the causes also were nausea and vomiting. Okay, so the aim of the study, Sanderson et al. Wanted to find out if participants, when presented with a range of alcoholic beverages, would choose the alcohol even when connected to a chemical shock stimulus. So the methodology and the conditioned response. So there was 5 presentations of a bottle of alcohol, which was gin. Each trial went for roughly a time period of 5 minutes. And there were also 10 different trials. Each trial had the same bottle of alcohol, so there was consistency in the methodology. So the participants involved were all suffering alcoholics. So we had a sample size of 10 men. It's a bit of an animation for you. And 3 women. So the results. So Sanderson et al. Found that after the first trial, participants became familiar with the stimulus. They knew that every time they would reach for that bottle of alcohol, they would in fact be shocked. So this actually created a fear and anxiety for the participants. So yeah, the chemical shock stimulus actually created a sense of fear, and participants became scared. In fact, they did do, participants reported that they described the process of the study as harrowing and thought they were going to die, which I think reflects poorly on the study, that it didn't really account for emotional anxiety and trauma. So conclusion, we can say that participants were less likely to drink when connected to the shock stimulus. And we can say also that in this case, the trial was in part quite successful because it actually instilled this fear into the participants that they weren't going to drink. So for alcoholics, I guess this can be seen as in part a successful study, because they were less likely to reach for the bottle of alcohol and drink that when connected to the shock stimulus. However, there was relapse following the study. And Sanderson et al. In fact didn't really take this into consideration when designing the study. There was relapse. So participants following the study did continue to drink. So limitations, as I just said, there was relapse. Also, didn't account for the emotional trauma, so the anxiety and the fear. So that wasn't the focal point of the study at all, and they didn't consider that. So the follow-up trial was unsuccessful. So 12 months follow-up of the study was unsuccessful because, as I said before, participants had relapsed, and many had actually been hospitalized following the study. So that was a very limitation study, massively unsuccessful in that part. Also, the study had no statistical analysis, and I'm not sure whether that is because it was one of the first studies during that period on chemical shock stimulus. There was no statistical analysis though, so we actually had no idea really further on how these participants would go. There wasn't, any accurate analysis at all. Also, sample bias. We had 3 women and 10 men, so there was an uneven amount of participants. They could have possibly had 10 men or 10 women, but it was uneven. Also, an exceedingly low sample size. If we're looking at alcoholics and examining different people, this was very low sample size. No placebo effect either, and no control. So we didn't have anyone in there who was a non-alcoholic and tested their response if they were a casual drinker, or if they were, a non-alcoholic or a casual drinker. We didn't also have any other form of drinking, so there wasn't like a soft drink in comparison to alcohol. There was no other form of drinks provided. So I guess we can say in part the study was successful in that it instilled a fear for the participants, but it was unsuccessful in the follow-up and not accounting for emotional trauma. Thank you.